My name is Matthew Thomas, a staff nurse, and I've been working as a nurse since 2004. I'm here today because I feel it's important to make our voices heard, to ask that change needs to happen and wages need to be fair in the NHS, because otherwise more people are going to leave the NHS and it's going to become even more unsafe. Well, I'm totally against any laws that prohibit striking and protest, because I feel it's our right to withdraw our labour, have to protest against anti-protesting and strike against anti-striking. I'm totally against war, and I'm for equality and fair pay, and we could cut all the budget on defence and put it into the healthcare. We could pay everyone a good wage, and we could offer a really amazing service overnight. Definitely support more money for healthcare and less money for war.
Elena Jimenez, I work for the education team in the hospital. I think that we deserve a better future, and we are not going to get that without better pay, being able to recruit nurses and helping the students that will become our nurses to stay in our trust. Well, I think that 7% is not quite enough to help these nurses that are having to go to the food banks and struggling to pay the rent because the inflation is over that level. So I think that is not enough.
Simon, I'm a nurse. I've been nursing since 1982. I'm here today because the RCN have voted to go on strike. I advocated it amongst my colleagues, and I feel this is the right thing for us to do. The cost of living has gone up, as we all know, and it's impacted me on an everyday basis. I've got a daughter at university as well who I'm supporting, so it impacts us on a daily basis. So they can fund track and trace, and if they can fund the people who got the PPE, the appalling PPE that we all had to use, then I'm sure they can find money to fund the pay rises that the nurses need.
My name is Barry. I'm here today to give support to these wonderful people who have looked after me for many, many years, who have always been there when I need them, and now it's my turn to be there for them when they need support from me. For the last 13 years, we've had a government that are totally anti-NHS. The NHS was never meant to be privatised. The NHS has been and always should be free to all those who use it.
Hi, my name's Carmel. I've been a nurse at Arrow Park Hospital for 31 years, and I've not taken this decision lightly to strike. However, I feel like there's no other choice. Not just about pay for us, it's about patient safety. Patients are suffering because there's not enough nurses. Nurses do not want to go into the profession because of the way they're treated and the conditions. We care about our patients, and we deserve a pay rise.
If the government don't get the backsides into gear, it'll go to a full strike. All the care support workers, all the doctors, all the nurses, all the professionals will come out.
Yeah, I'm here as a member of the public. The NHS has been, destroyed by this government, and will continue to do so. The bell bent on making this a private organisation, and they're not caring about patient care. They're not interested in patient care. They're really interested in themselves and their mates making loads of money, as you see with the energy companies. We've got to wake up to reality. And the reality is, you won't have a doctor, you won't have a nurse left in the system. And if you're going to die, you're going to die horribly.
My name's Linda, and I'm retired, and I'm here because my daughter's a nurse. So I'm here to support her and her colleagues, and I'm very angry with this government for everything that it's doing. They've got no support for any of the workers. They're trying to take away workers' rights and everything, and I just get really cross with them. And I think the thing with this is it's not just about pay, and I think people think it is just about pay, but it's not. It's about their conditions and safe numbers and being able to look after their patients. So that's why I'm here today to support nurses.